Bismillah ar-Rahman ar-Rahim. The second oral question lecture on rheumatoid arthritis. A long case of rheumatoid arthritis. What are the most probable question to you if your case is rheumatoid arthritis? Long or short, or even oral? The first question, what are the criteria for diagnosis of rheumatoid arthritis?
The major criteria for diagnosis rheumatoid arthritis: early morning stiffness, high rheumatoid factor.
We need four of these. We need four of the following.
Okay.
One,
Early morning stiffness. We have rheumatoid factor, high
rheumatoid
titer,
nodule,
rheumatoid nodule, rheumatoid factor, high titer, and X-ray. We have erosion and symmetry, and we have three joint involvement. Symmetry.
Symmetry, زين.
And X-ray, erosion and symmetry.
Okay, that's good. Therefore, what are the criteria to diagnose rheumatoid arthritis? Are four criteria. We need four of the following. First of all, rheumatoid nodule, we said it occurs in 25%, 20 to 25%. The second criteria is the morning stiffness. The third criteria is the rheumatoid factor, which is high titer. The fourth criteria is three joint involved, symmetrical, and X-ray erosion. Okay, these are how to diagnose. Four of these diagnosis will settle. The other question is to you. What are the extra articular signs in rheumatoid arthritis?
Rheumatoid, we see it in elbow and wrist, and
إذا rheumatoid nodule.
it's nodule, and we can see it in elbow joint,
الريست جوينت، الهيد، الساكرم،
sacrum joint.
كل تندن اكيليس هاي كلها سايت مالتها.
Yes.
Second,
The second vasculitis is
vasculitis, yes.
Vasculitis with fever.
With fever and usually occurring in what? In male. Mainly
yes.
in male.
Yes.
Yes.
Cardiac involvement.
Cardiac involvement, lung involvement,
And
eye involvement,
eye involvement, and faulty syndrome.
faulty syndrome اللي هو شنو هو neutropenia, faulty syndrome, splenomegaly, neutropenia, and recurrent infection. To you the question, cardiac involvement in rheumatoid arthritis, what are the cardiac involvement?
Pericarditis.
Pericarditis is the first, a block,
And coronary artery disease.
and coronary artery disease. Okay, to you, what are the lung involvement in rheumatoid arthritis?
Pleural effusion.
Pleural effusion, pneumonitis,
Pulmonary fibrosis.
and pulmonary fibrosis. Three, pleural effusion, pneumonitis, and pulmonary fibrosis, and pleural effusion mainly in male rheumatoid arthritis. Yes, what are the causes of postural hypotension in rheumatoid arthritis? By postural hypotension mean the patient is dizzy on standing, and when we check blood pressure, we found that blood pressure systolic decrease on standing more than 20 millimeter. That's why he felt dizzy. What are the causes of postural hypotension in rheumatoid arthritis?
Amyloidosis.
Amyloidosis is the first cause.
Sodium losing nephritis.
Sodium losing nephritis, the second cause. Bleeding.
Severe anemia.
Bleeding per rectum and causing severe anemia. Yes, good. والسؤال اللي إلك مو إلك إلك what is the causes of clubbing in rheumatoid arthritis?
The club in the rheumatoid, the causes it is fibrosis and alveolitis.
Yes, pulmonary fibrosis. If you see clubbing in rheumatoid arthritis, think of pulmonary fibrosis and alveolitis. Other question to you.
Yes.
What is the anti-CCP in rheumatoid arthritis?
It's just
It is a test.
it's a test.
It is a peptide.
Yes.
Yes.
But it's not specific. It's
95% is specific and sensitive
Sensitive.
in
also it's
95%.
95%.
Yes. And it might occur before the disease or early in the disease.
Yes.
Okay, therefore it tests anti-CCP is a peptide, is a test specific for rheumatoid arthritis. It is sensitive in 95% and specific in 95%. And it might occur years before rheumatoid arthritis or even on the start of rheumatoid arthritis. The other question to you, what are the causes of, what are the relation between smoking and rheumatoid arthritis?
No, if both identical twins, now it's
We took identical twin
identical twin.
and we look for this relation between smoking and rheumatoid arthritis. If both are non-smoker,
If both are non-smoker,
the identical twin, if they are both non-smoker and one occurring get rheumatoid arthritis, the other
another one will
it will get it.
We will get it.
If one of identical twin is a smoker and he got rheumatoid arthritis, the other one is non-smoker,
We will getting.
he get no rheumatoid arthritis. Therefore, relation is obvious. The other questions is what is the characteristic things in the pleural effusion in rheumatoid arthritis?
Low glucose.
Yes, low glucose in the pleural effusion. Why is low glucose in pleural effusion? Because of a faulty in transport. There is failing transport of glucose to the fluid. Defect will transport. The last question to you, what is the Felty syndrome?
Felty syndrome is leukopenia, recurrent infection with splenomegaly.
Yes, in rheumatoid arthritis, if you see leukopenia, if you see repeated infection, chest or anywhere infection, and you see spleen, this is Felty syndrome. Okay, it is one of the criteria to diagnose what rheumatoid arthritis. Good. This is the last thing about rheumatoid arthritis. We cover all the questions expected to be asked about rheumatoid arthritis. Thank you.